Our top story this morning, though, the Omicron strain of COVID-19 continues to spread rapidly here in South Korea, leaving daily caseloads well in excess of the 10,000 mark. This coming ahead of the big Lunar New Year holiday. It's going to last 5 days, and we'll see millions of people in South Korea travel around the country to visit their relatives.
For more on this and related updates, we have our reporter Shin Ye-eun here with us in the studio. Good morning, Yeun.
Good morning.
So let's start with the infections we're expecting for today.
Right, Mokyeon, we're expecting to see Friday's figure stay near the 14,000 mark. Up to 9 p.m. yesterday, recorded 11,804 infections. This was a drop of 606 from a day ago, but still quite a large number compared to just 4 days ago, when only some 7,000 were logged during the same time. And daily infections have been doubling faster than authorities had forecast. During a special briefing held Thursday to explain what the Omicron variant entails, KDCA Commissioner Shin Ye-eun said though the strain is quite concerning, it's not to an extent that it threatens medical capacity.
After analyzing the regions in Korea hit hardest by Omicron, we realized that the number of infections increased exponentially, but the number of those in critical condition was actually lower than the average tally in the country. We've seen the number of critically ill come down and have restored stability in our medical capacity with enough hospital beds available.
Okay, so that briefing was specifically about Omicron and how South Korea plans to deal with it. What were some of the key takeaways?
Right, so experts who participated in Thursday's briefing said Omicron isn't as fatal compared to other variants. It's actually comparable to a seasonal flu, but with symptoms a bit more severe. Citing a study from the UK, experts explained most people who were infected with Omicron reported having a cough, runny nose, headache, fatigue, and sore throat. While Omicron may not cause people to develop severe illnesses, it can still weigh heavily on our medical capacity, given that it's twice as transmissible as the Delta variant. There were also questions in regards to whether our current testing kits were effective enough, especially since we've seen 4.5% of imported Omicron cases classified as stealth Omicron. Like its name, the stealth Omicron is a subvariant known as BA2 that hasn't been easily identified using PCR tests. But Shin Ye-eun gave assurances that Korea's homegrown variant PCR tests have been able to detect this strain. She added that this subvariant isn't of concern yet, but monitoring will continue. As to how Korea will tackle the spread of Omicron, the KDCA chief cited the importance of efficiently utilizing our limited medical and quarantine resources.
We are expanding the number of hospitals and clinics that are able to monitor patients being treated at home. We're also planning to bring in some 31,000 courses of antiviral pills at clinics by the end of January. They're currently being used on those with weak immunity and seniors over 60 to prevent them from developing severe illnesses.
And that explains why the country is set on using rapid antigen test kits as the latest screening method for most of the population instead of PCR tests. Excluding people over 60, those at high risk, or those who came to close contact with an infected person, everyone else will have to test themselves with a rapid antigen test kit at testing sites or even at local hospitals starting February 3rd. Now, testing sites across the nation will have them ready from Saturday. Likewise, authorities are also set to keep the current social distancing measures in place instead of toughening them even after the Lunar New Year holiday, when many are expected to travel and visit their relatives.
So, Yeun, exactly how many people are expected to travel over the Lunar New Year holidays, and what do authorities, kind of have any advice for them?
Right, some 28.7 million people are expected to move across the nation from this Friday all the way to February 2nd. The Ministry of Land, Infrastructure and Transport forecast an average of 4.8 million people to travel each day during the holiday. This is an increase of 17% from last year. The government is highly recommending people to refrain from traveling as a whole, but to those that must go, they're asking them to get booster shots and COVID-19 tests ahead of time. Also, to make their visits short, refrain from using public transportation and rest areas along the road. Also, to wear masks that are certified KF80 or higher at all times.
All right, Yeun, thank you so much for your report. Have a happy and safe holiday.
You too.